Breaking tonight at 11, that doctor who performed a legal abortion on a 10-year-old rape victim from Ohio is responding tonight to threats from Indiana's Attorney General Todd Rokita. At 2:30 this afternoon, Rokita announced he was investigating the situation, looking into whether the abortion and abuse were reported to the state, which is required, and said her license was at risk. So just hours ago, we reached out to Dr. Caitlin Bernard, and we finally heard back tonight. Our Rachel Krause kicks off our coverage tonight with the doctor's response.
In a new statement tonight, Dr. Caitlin Bernard's lawyer tells us she took every appropriate and proper action in regards to the law and her medical training, and says she followed all policies, procedures, and regulations, stressing Dr. Bernard has not violated any laws, including HIPAA. She also condemned Attorney General Todd Rokita for smearing her name, saying facts will come out in due time.
And Rachel, you also heard concerns from the healthcare community about doctors who are trying to help patients, right?
Yeah, I've spoken with both doctors and lawyers who are really concerned, especially with this upcoming legislative session. They say that if lawmakers ban abortions with few exceptions, as they are expected to do, they say it will have a chilling effect on doctors, questioning if they're legally able to provide the medical care that their patients need.
People are going to get hurt because physicians are afraid to act.
Dr. Caroline Rouse works with pregnant women every day. Often these pregnancies are wanted, hoped for, but due to medical conditions with the mother or the baby, Dr. Rouse says sometimes, sadly, they need to medically manage or terminate pregnancies. But with the future of abortion in Indiana playing out on the political stage, she worries about how future laws and restrictions could stifle a doctor's ability to provide life-saving medical care.
I think a lot of medical providers, myself included, are concerned that we are going to be potentially criminalized for providing evidence-based medical care that patient needs.
Jennifer Droback, a law professor at IU's McKinney School of Law, says news of Indiana's Attorney General threatening to go after a doctor for providing an abortion is making international news right now. She's been able to watch the latest from the Hoosier State unfolding from Portugal. While abortion is still legal in Indiana, Droback says she is not surprised to see the state's top attorney stretching the law in an effort to target this doctor for helping out a pregnant 10-year-old.
But this is not about child abuse, because the abuse and the attack on the child was already reported. This is about somebody's political agenda trying to chill a doctor from providing needed medical services to this poor girl.
Rokita's claims focus on allegations that Dr. Bernard had potential reporting issues to the state, claims the doctor denies. 13 News also spoke with attorneys who went through Dr. Bernard's record on reporting abortions to the state. They were not able to identify any issues with her reporting.
Tonight, we're digging into new data released by the state on the number of abortions here in Indiana last year. There were more than 8,400 pregnancies terminated in total. 67 of those were people 16 or younger. 465 people came from out of state to get an abortion here. More than half came from Kentucky. The youngest person to get an abortion here in our state last year was 12, but the average age was around 27. Our state has seen an increase in abortions over the last 2 years. In fact, you can see the full report. We've got it posted for you right now. It's on WTHR.com.